Good evening. Myself Dr. Rahul, and today we'll discuss artificial intelligence in anesthesia. Artificial intelligence will only come as a 5 marks question, maximum 5 marks question. It is already asked in some of the exams, like in 2022, I think it is already asked artificial intelligence in anesthesia. Whenever a question comes from, I have taken this artificial intelligence from Indian Journal of Anesthesia. I want to thank the Indian Journal of Anesthesia. They have written very nicely pre-op, intra-op and post-op what are the uses of artificial intelligence. So let us see whenever you are how this artificial intelligence can be done in the pre-anesthetic care. Coming to the perioperative risk stratifications. So whenever you are feeding the software of this artificial intelligence like American Society of Anesthesia Physical Status or ASA gradings, and you are putting data on the computer, you can easily get the ASA grading by using AI. How the artificial intelligence can be used in the perioperative risk stratifications? By using this American Society of Anesthesiologists Physical Status Risk Stratification exam scoring, my surgical risk or my surgery risk screening tool, AI detect post-operative delirium and preoperative risk factors. Whenever you are putting some of the preoperative risk factor to the patient, suppose my patient is having old age, my patient is diabetes, my patient is having alcohol dependence, my patient is cigarette smoker, my patient is COPD, my patient is taking other drugs like amphetamines and other things. So in this way, the AI can detect whether the patient is having preoperative or the post-operative chances of increasing the delirium or not. Because all this already given to the app or the AI app, so that the AI will easily detect what is the ASA grading, what is the my surgery risk score, chances of or outcomes of the post-operative delirium or not, depending upon the pre-operative risk factor. Prediction of the difficult airway by using facial pictures. Suppose the patient is having buck tooth, the patient is geriatric, the patient is edentulous, the patient is having high neck circumference, or the patient is having obesity, the patient is having monkey faces like things, or the patient is having like the thyroid gland swelling. So whenever you are putting so much of image of difficult airway, the AI can identify whether it is a case of difficult airway or not difficult airway. Mouth openings, the sternocleidomastoidal distance or thyromental distance or hyomental distance, they cannot calculate that much. But by identifying different facial images or facial pictures, they can identify which one is a case of difficult airway or which one is not a case of difficult airway. So in this way, AI can also help us to identify difficult airway. Checking the completeness of preoperative checklist. Whenever we are doing a PSC in the suppose the PSC, what will we fill about the so much patient, and in case of busy hospitals, we are doing preoperative checklist or preoperative check or PSC check very lightly. Suppose we only calculate the risk factor. Yes, diabetes, hypertension, COPD, these are the risk factors, this thyroid, and these are the medications taken. Okay, the PSC is very much fine. We least undergo for the checking of the airway, checking of the tube, checking of the artificial teeth, dentures, checking of the neck movements. So all these things we can never check. And second thing is that the preoperative hemoglobin levels. So these things sometimes it is being missed. But whenever you are using a app which is already fitted with all the vital parameters, so your PSC checkup will be incomplete by using AI. Suggested appropriate preoperative checklist. So whenever you are preparing a preoperative checklist, the AI can easily help to provide the appropriate checklist. Coming to the, by using AI, you can do tele-PSC through telemedicine. Suppose your assistant is seated in the hospital or in the PSC clinic, and he is entering all the data. And suppose a decision came, clinical decision support system, a decision came that is not PSC, it is not PSC fit, it is not anesthetically fit, the patient is in case of difficult airway due to this risk factor. So at that time they can call and you ask for your guidance. Otherwise, maximum patient, 90% of the patient, there will be the software can detect, no, these patients are almost all good, all investigation are good, this patient is PSC fit. So in this way we can do the preoperative by using the tele-PSC clinics. Preoperative patient educations like smoking cessation, initiating respiratory exercise, or alcohol cessation, these things can be also given by the AI systems. How what are the benefits of smoking cessations, what are the benefits of initiating respiratory exercise, what are the beneficial effects of the decreasing weight loss, doing weight loss before surgeries. So these things can be easily told by the AI app, and this thing can be easily done through the AI software. So clinical decision support system can be done through telemedicines. Coming to the intraoperative period, these are the preoperative period. So in the preoperative period, mostly the tele-PSCs, preoperative checklist, identify difficult airway, and completeness of the PSC clinics. These things can be done in the preoperative period. So in the intraoperative period, what we can do now, there is AI enhanced ultrasonography comes, which helps in the enhancement of the needle T visualizations. So needle T visualization can be enhanced through AI enhanced ultrasonography. Scan nav, so scanning of the nerve, or scan nav highlights and color key anatomical structure in the real time. Epidural space identifications, these are the key highlights of the AI enhanced or AI based ultrasonographies. So by these things we can improve our ultrasound skill, or we can improve our sonography skills. We can also improve the nerve block techniques through this AI enhanced ultrasonographies. Robotic intubations. Nowadays during COVID also we have tried for robotic intubations. Also in case of difficult airway we can go for robotic intubation. So there are two types of robotic intubations we have in our market. Remote robot assisted intubating system, RRAIS, and automatic intubation robotic system, that is AIRS. So this is only possible through artificial intelligence. So robotic intubation is a part of artificial intelligence in the intraoperative period. Here no doubt the anesthetist handles a robot, but the degree of flexion and the degree of movement of the robot arms is very much high, so that we can easily do difficult intubations by the robot. Drug administrations through, there are two loops, open loops. We will discuss what is TCI and how the TCI work by using the pharmacokinetic and pharmacodynamic parameters of the patient and the drugs, and how it is easily able to achieve the systemic plasma concentrations, and how the chances of decreasing the awareness, and how the patient will recover very smoothly by using TCI. We will discuss. It is a AI based software and AI based pumps. Closed loop anesthesia delivery system known as CLADS. They have two types: single input single output system, that is known as CISO, and multiple input multiple output system. They are based on the depth of anesthesia. So the chances of now awareness is an important medical legal issue, we all know. So therefore we have to maintain a particular depth of anesthesia throughout the intraoperative period, and to monitor the depth of anesthesia we have this multiple inputs and multiple output system. What is multiple inputs? So we can put different types of monitoring, that is input Bs, EEG, like 10 or 4 monitoring. So we can put different types of input to the monitor, and the monitor will put different types of output, like it will increase the target concentration of the inhalational agent, it will increase the target concentrations of the IV anesthetic agents, it will go on putting different neuromuscular blocker drugs. So multiple inputs and multiple outputs. So it will not only monitor the depth of anesthesia, it will also see the opposite side of the effect of the drug, like fluid administrations, hemodynamic monitoring, so fluid administration, vasopressure administration, inotrope and vasodilator administration. Because we all know there are systemic complications. By any time the patient will go on vasodilatation or hypertension or the bradycardia or tachycardia. So this will monitor different types of inputs. So it will also monitor the hemodynamics effect, it will also monitor the systemic effect of the drugs, and there are multiple outputs of the machines. So MIMO and CISO, these are the important parts of the closed loop anesthesia drug delivery system. This closed loop anesthesia drug delivery system was a 2 marks question in the previous year, 2023 April. CLADS was an important short note. This only you just write single units, single input, single output, and multiple input, multiple output. This is a part of the artificial intelligence in the intraoperative period. So monitoring, smart alarms system with enable closed drug systemic system, or known as CDSS. Okay, so smart alarm systems which enable the closed drug systemic system. Okay, risk procedure, AI based early detection of the, we identify acute kidney injury by using the urine output less than 0.5 ml per kg per hour when the patient develop in the intraoperative period. It is AI, but before that the AI can detect the acute kidney injury in the postoperative period. AI also detect the postoperative mortality following the cardiac surgery, where there are different types of cardiac surgery we are doing, and also we are doing also non-cardiac surgery in the cardiac patient. So it is, there are different types of score, there are different types of monitoring tool in the preoperative period which can be done in the non-cardiac patient before taking the patient for non-cardiac surgery. We will discuss it. But when you are using AI based predicting postoperative mortality scoring system, we can easily detect through AI apps. So when the exam comes, what is the role of artificial intelligence in anesthesia? You can write in 3 headings. Preoperatively, we have already discussed. We have already discussed the intraoperative system. So clinical decision support system, the monitoring. in the monitoring also, in case of drug administration also, in case of robotic intubation also, in case of ultrasonography also, all this AI can help. Coming to the post-operative care, so post-operative pain management, wireless intelligent patient like control analgesia, that is YPCA. Before that we have patient control epidural analgesia, patient control IV analgesia was there, but they are all wire based. This is wireless based, so this is WI wireless based patient control analgesia are there. To assess the severity of the post-operative pain from the facial expressions, we have different types of scale, NRS, VAS. So by using different facial expression, by the use of AI also, we can identify whether the patient is in pain or not, because it is objective method of calculation. Prediction of the post-operative opioid use in opioids in opioid naive patients. So with the patient who are taking opioids, in that patient also we can calculate the post-operative opioid use. Post-operative types of fluid administration we can also detect through AI, and monitoring of the daycare patient through the telemedicine also we can do through the AI apps. So these are all the post-operative values. So most important is the WIPCA, because pain is the most important aspect in the post-operative period that it can be easily taken care of by the artificial intelligence system. So these are the three headings: pre-operative, post-operative, and in pre-operative, intraoperative, and post-operative. Always remember this: in pre-operative, robotic intubation is the important aspect. PSC clinic, tele-PSC clinic is the important aspect. Prediction of the difficult airway is an important aspect. Second thing, in the pre-operative period, ultrasound, robotic intubation, TCI, CLADS, and this CISO and MIMO is the important part. And in case of the post-operative period, the WIPCA. So as much as you will write, you will get the answer, but your written or your format of writing the anesthesia, artificial intelligence in anesthesia, or what is the significance of artificial intelligence in anesthesia, is always will be in the three endings: pre-operative, intraoperative, and post-operative care. You will get the good marks. So it is only for the theory purpose. It will not come in OSCE, it will not come in practical. Thank you.